Dr. Harrison and nurse Elena Vasquez faced a critical case from the emergency room just 30 minutes after completing a grueling 6-hour heart surgery. Dr. Harrison's eyes were watering from exhaustion and his hands had started trembling. "Elena, this case can't wait. There's a risk of cardiac arrest," he said breathlessly. In the middle of the surgery, Dr. Harrison's knees buckled and he collapsed to the floor. The patient's heart was beating irregularly on the monitor, blood pressure dropping. At that moment, Elena did something very different from the panic around her. She maintained her composure and stepped up to the operating table. "I will complete the surgery," she said with determination. The other nurses looked at her in shock. "Elena, you're a nurse, not a surgeon." But Elena had already taken the scalpel in her hand because the operating room wasn't a foreign place to her. And in the next 2 hours, everyone at Sacred Heart Hospital would learn who Elena Vasquez really was, because some people wear nursing uniforms but actually have surgical training. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from and hit that subscribe button. Elena Vasquez was Sacred Heart Hospital's most reliable operating room nurse. The 33-year-old brunette had been working at the same institution for 3 years. She delivered flawless performance in every shift, systematically prepared surgical equipment, and maintained perfect coordination with doctors. With her dark brown hair neatly tucked under her surgical cap, Elena maintained professional distance while still conveying warmth in her approach to patients. Her brown eyes carefully followed every surgical procedure, and the steadiness of her hands gave confidence to the doctors. Elena's surgical team consisted of Chief Physician Dr. Harrison, anesthesiologist Dr. Thompson, and assistant technician Marcus Chen. Harrison was a respected 45-year-old doctor specializing in cardiac surgery with 15 years of experience. Thompson was a meticulous 38-year-old specialist who had been administering anesthesia at Sacred Heart for 9 years. Elena's surgical approach was far above standard nursing protocols. During preoperative preparations, while others performed routine checks, she organized surgical instruments with military discipline, planning every detail in advance. "Where did you learn this precision?" they would ask. "Experience," Elena would say briefly. Elena's equipment management was distinctly different from her colleagues. She would check surgical instruments as if preparing for war, organizing emergency supplies as if preparing for a critical operation. "We're just nurses, Elena, not commandos," they would joke. Elena Vasquez had joined the army at age 19. She had lost her mother to a sudden heart attack during her childhood years. That day, she made a promise to herself: "I will get the most advanced surgical training." When she joined the army, she chose the Field Surgical Specialist program. After basic military training, she was selected for special surgical training. Army Field Surgery Program, a 20-month intensive surgical training process, surgery under combat conditions, life-saving with minimal resources, surgical operations under enemy fire. Elena was selected for the top 3%. "A field surgeon isn't just a medical specialist," her training commander had said. "You're the person making life and death surgical decisions. Even under bomb explosions, you'll be operating on wounded soldiers." The most challenging part of her training was surgical operations in combat zones, surgery under enemy attack, performing complex surgical interventions with basic tools. Elena had gained extraordinary skills in these areas. In her first deployment, she was at the Forward Surgical Hospital in Afghanistan. Surgical operations in combat zones, operating on wounded soldiers after explosive attacks. Elena's most critical intervention was saving a sergeant severely wounded in a rocket attack. In her second deployment, she was with the Combat Surgical Support Team in Iraq, surgical support in urban warfare, emergency surgeries after insurgent attacks. The techniques she learned in these deployments were methods never used in civilian hospitals. Her third deployment was classified surgical operations at the Syrian border, surgical assistance in covert operations, medical support for special forces. Elena had now gained surgical expert-level competency in all types of geographical and operational conditions. Over 11 years, Elena had successfully completed 203 critical surgical operations. So why had she left the army to become a nurse? This story was more complex: PTSD, adaptation problems, civilian life challenges. Elena's transition hadn't been easy. High-pressure surgical work felt familiar, but civilian procedures were different, and this tension would emerge that day. After receiving an honorable discharge in 2021, Elena had transitioned to the civilian healthcare sector. She used PTSD rehabilitation, adaptation counseling, and career transition support. Operating room nursing had been an ideal choice. When Sacred Heart Hospital hired her, Elena was overqualified. Nursing degree, 11 years of military surgical experience, field surgery certificate, but the hiring committee hadn't asked detailed questions. "I've always wanted to work in the operating room environment," Elena had said, and this time she was completely sincere. Daily work was comfortable compared to combat surgery, surgical preparation, doctor assistance, patient care. But Elena was doing much more. She evaluated every case from a field surgeon perspective. "Elena, how do you understand surgical procedures so well?" her colleague Marcus would say. "Observation," Elena would say. "Every surgery is educational." When her Tuesday evening shift began, Sacred Heart Hospital had an intensive surgery schedule. The cardiac surgery department had 3 complex operations planned consecutively. Dr. Harrison and Elena had started working non-stop from 8 a.m. The first surgery was completed in 4 hours. Bypass surgery successful. The second operation took 2 hours. Valve replacement flawless. But the third surgery turned out to be much more challenging than expected. 58-year-old Michael Torres's heart had damage at 3 different points. Complex reconstruction surgery was required. Dr. Harrison and Elena worked for 6 hours without stopping. When the surgery ended, it was past 9 p.m. Dr. Harrison was exhausted. His hands had started trembling from fatigue. "Elena, we've done 13 hours of non-stop surgery. We need to rest a bit." Right then, an emergency room call came in. "Dr. Harrison, we have an emergency heart attack case coming. Ambulatory cardiac arrest. Immediate surgery required." Dr. Harrison rubbed his eyes. His fatigue was visible. "How urgent?" "Life-threatening. ETA 15 minutes. "Let's prepare," said Dr. Harrison, trying to stand up. Elena assessed the situation. Harrison's condition looked risky, but the patient couldn't wait. When 45-year-old James Wilson arrived by ambulance, his condition was critical. Massive cardiac arrest, multiple vessel blockage, immediate bypass surgery was required. When Dr. Harrison entered the operating room, his steps were staggering. "Elena, this case can't wait. There's complete coronary occlusion," he said while having difficulty breathing. The surgery began. Dr. Harrison made the first incision, but his hand was trembling. The effect of 13 hours of non-stop work was obvious. "Doctor, are you stable?" Elena asked with concern. "I'm fine. Let's continue." But Dr. Harrison wasn't fine. His eyes were blurring. He was starting to sweat. At the most critical stage of the cardiac bypass procedure, his hands lost control. "Dr. Harrison." Harrison slowly staggered and collapsed to the floor beside the operating table. Exhaustion collapse. The operating room panicked. Anesthesiologist Dr. Thompson immediately began treating Dr. Harrison. Severe dehydration and exhaustion. Immediate rest needed. Marcus was in panic. "What are we going to do with the patient?" "The surgery is half finished." James Wilson's heart was beating irregularly on the monitor, blood pressure dropping. They were left without a doctor in the middle of open heart surgery. "The nearest cardiac surgeon is 45 minutes away," said Dr. Thompson. "But James can't wait. There's cardiac arrest risk within 10 minutes. At that moment, Elena did something very different from the panic around her. Maintaining her composure, she stepped up to the operating table. "I will complete the surgery," she said with determination. Dr. Thompson looked at Elena in shock. "Elena, you're a nurse, not a cardiac surgeon." "I know what I'm doing," said Elena while putting on surgical gloves. Marcus screamed in panic. "Elena, this is cardiac bypass surgery. You can't do this." But Elena had already begun organizing the surgical instruments. Her 11 years of field surgery training automatically kicked Indiana. This was her expertise. "Dr. Thompson, continue anesthesia monitoring. Marcus, keep surgical instruments ready. I'll complete the cardiac repair." "Elena, this is impossible," said Dr. Thompson. "Cardiac surgery requires years of specialization." Elena looked at the open heart in the patient's chest. Multiple blockages in coronary arteries. Cardiac muscle damage. Complex reconstruction was needed. "Dr. Thompson," said Elena calmly but decisively. "I know cardiac surgery, trust me." Elena took the scalpel in her hand. After 11 years, field surgery training was reactivating, but this time it wasn't a battlefield. It was a civilian operating room. "Continuing coronary bypass," said Elena. "Marcus, suction and retraction. Dr. Thompson, cardiac rhythm monitoring." Elena's hands began working with surgical precision. Every movement was calculated. Every cut was professional. She located cardiac vessels, identified blockages. "How is this possible?" Marcus whispered. Elena didn't answer. That night in Afghanistan came to mind. Open heart surgery after a rocket attack. Minimal equipment, maximum expertise, successful operation. "First bypass graft completion," said Elena. "Second vessel access." Dr. Thompson just watched. Elena's surgical skill was incredible. While Elena managed the surgery, she also coordinated the entire team. Marcus, surgical instrument inventory. Thompson, blood pressure and cardiac output monitoring. This came from field surgery team leadership training, surgical leadership under extreme conditions, resource management, critical decision-making. "Elena," said Dr. Thompson. "You've done this before." "Yes," said Elena, focusing on cardiac repair, under much more difficult conditions. Marcus looked amazed. "Elena, this isn't normal nurse performance." Are you a surgeon?" Elena hesitated. It was time to break 3 years of secrecy. While the surgery continued, she began to speak. "I served 11 years as a U.S. Army field surgeon specialist. 3 deployment periods, Afghanistan, Iraq, Syrian border." Complete silence in the operating room. "Field surgeon," said Dr. Thompson in disbelief. "You were a military surgeon. Advanced cardiac surgery, battlefield conditions, trauma surgery, emergency leadership." Marcus's eyes widened. "Elena, you were a special forces surgeon." 2 hours later, Elena was placing the final sutures. James Wilson's condition had stabilized. The cardiac bypass surgery had been successfully completed. "Operation completed," said Elena, removing her gloves. "Patient's vital signs stable." Dr. Thompson examined the surgical results. "This is extraordinary cardiac surgery performance. Perfect technique." Marcus was still in shock. "Elena, this is incredible. You're a real surgeon." Elena answered while washing her hands. "In a different context. Now I'm a nurse." "No, Elena," said Dr. Thompson. "You're a legend." The next morning, there was major change at Sacred Heart Hospital. Elena's story had reached hospital management. Chief Medical Officer Dr. Anderson called an emergency meeting. "Elena, last night's performance was extraordinary." "Thank you, Dr. Anderson, but I need to learn about your real background." Elena explained her situation. 11 years of military surgical experience, battlefield surgery expertise, combat surgical leadership. Dr. Anderson was amazed. Why are you working as a nurse? Because I want to serve people in civilian life. Rank and title don't matter. Elena, you're our hospital's most valuable asset. Would you manage the advanced surgery department? Elena hesitated. I'd prefer to stay in patient care. When James Wilson's family learned about Elena's story, they came to the hospital. Ms. Vasquez, said James's wife, Maria Lopez. I don't know how to thank you for saving James. I just did my job, said Elena. No, said James's son. The doctor said under normal conditions, the risk of losing Dad was very high. Your surgical expertise saved him. When James woke up, he saw Elena. Are you the nurse who saved me? Yes, James. How are you feeling? Very good. This nurse was a real hero. Elena smiled. You're very strong too, James. After Dr. Harrison recovered, he told Elena's story to the entire surgical department. Elena's story also caught the attention of other hospitals. She began providing emergency surgical training. Emergency surgery isn't just equipment, she would say in her training sessions. Adaptability, improvisation, alternative surgical solutions. Most importantly, never give up on the patient. But you're a field surgeon. We don't have that kind of training. Military surgery teaches you adaptability, life-saving surgical solutions in any emergency. The same principles apply in civilian surgery. Elena's training program, emergency surgery with limited resources, surgical team leadership, crisis surgical management. Elena was still working in the same nursing position at Sacred Heart Hospital. James had completely recovered and returned to his normal life. Elena's greatest achievement was the sense of confidence she gave to hospital staff. As long as Elena is here, we can handle any surgical crisis, Dr. Thompson would say. One day, hospital director Martinez asked Elena, do you ever regret leaving your big military career? Elena watched the team working in the operating room. They were providing surgical care to patients, saving lives. No, Martinez. I protected soldiers for 11 years. Now I protect civilians. Same mission. Elena pointed to the patients. Yes. The life-saving mission never ends. Only the location changes.